Hello, everybody. Good morning. It's June 10th, 7 a.m. Pacific time. Okay, let's talk about how to take care of your pet's incision. I am Dr. Arafij from Vet Triage. So, this conversation is going to probably apply to your pet situation, even despite knowing what surgery your pet had. The goal of this fun informal discussion is to talk about how to just take care of the incision part. So, for example, let's say your dog had orthopedic surgery, they repaired a fractured bone. Um, and they're going to give you instructions for how to make sure that your pet does not mess up their fancy repair, and that includes the incision. But for this discussion, we're going to be focusing on just the incision part and not like the bone healing part, for example. So there's a couple things to take into consideration when you look at what are the chances that an incision is going to heal without any complication. This is before you even get to the actual home care instruction part. What surgery did your pet have? Was it performed under controlled or emergency scenarios? Does your pet have any other comorbidities? Is the incision on a location of the body that's at high risk for not healing well? Was there any reconstruction that had to be had to close the incision? Were there other surgical factors like contamination or bleeding, things like that could predispose the incision to not healing well? Those are just some of factors that will affect the pet's incision from healing or not healing well. Most incisions, and again, when we talk about incisions here, we are talking about the skin. We're not talking about incisions internally, like for bladder surgery or intestinal surgery. So skin incisions typically take 10 to 14 days to heal. It depends on the factors that I just mentioned, whether or not the healing rates will be slower than that. Most pets, it's not going to happen faster than that. That's just how skin heals. There are some incisions where any skin blemishes, skin defects that can heal in a couple of days or something like that. We've had paper cuts and heals in a few days. But as far as surgical incision goes, 10 to 14 days is what you're looking at. There are some scenarios where I expect the incision to take even longer, up towards a few weeks, because the surgical area was not considered sterile. It was a contaminated area, or it's in the incisions in an area of the body that has high motion, whereas in an area of the body that holds a lot of moisture, things like that. So anyway, 10 to 14 days is your typical healing duration for incisions. So now let's get into what do you do at home for pet owners. Number one, and this is literally number one, is the e-collar, the Elizabethan collar, the cone of shame that we place on dogs. So that plastic lampshade looking thing, it's vital. It's mandatory, in my opinion, for every pet who's had surgery, unless we know for sure that the pet cannot lick their own incision because it's on a location that they can't reach or whatever. So the e-collar helps prevent them from licking the incisions that they have access to with their mouths. And that's number one. That's the most important thing you can do. That's even above pain medication or antibiotics. It's the e-collar. So many failed incisions. So many times when incisions fail, it's because of pet self-trauma, and it's preventable, which is what makes it so frustrating, but also so easy to prevent. So that's number one. Number two, most important after the e-collar, is going to be restricted activity. No running, jumping, playing, no hiking, no camping, no rough housing. Your pet needs to be in a confined area at the home where they can have access to food and water. They go out to pee and poop, whatever schedule you have, and otherwise, they're going to be fairly sedentary for those 10 to 14 days, give or take, depending on what your veterinarian says. But no running, no jumping, no playing. And that's because when the incision, you expect it to heal, it's going to it needs a minimum motion as possible. Anytime there's motion, then the incision ends will move, and that's creating more stress, more trauma on the incision to prevent it from healing or slow down its healing. So restricted activities, number 2. Number 3 are going to be local type of therapy. So for example, should you put an ice pack on there? Should you put a warm pack? Most of the time, for the first 3 days at most during surgery, or after surgery rather, when the pet's at home or in the hospital, whatever, you're going to ice pack it, and then from after that point, warm compress it. Definitely follow your veterinarian's instructions regarding how to do this, how often, for how long. You don't want to burn your pet's skin with the warm compress. You don't want to cause tissue damage and nerve damage with the ice packing. So there are rules to this. You got to follow your vet's advice. So local compression, or rather compress therapy of the area is good. Number 4, protecting the area. So not every incision requires a bandage. Not every incision requires you to cover the incision. That your veterinarian would decide on whether or not it's worth it. There are pros and cons to having a bandage on the patient, which we can probably talk about at another time, another live stream. But not every incision requires covering up. And next advice is keep your pets separated from other pets. So even though your pet might have an e-collar on and might be restricted in terms of activity, let's say the other dog at home feels a need to clean the patient's wound, which they will, then they'll lick the incision, and that defeats the whole purpose of having the cone. So keep your pets separated. And then I think finally is just give whatever medications your vet recommends. So not every incision requires antibiotics. Not every incision requires analgesics. Not every incision requires non-steroidal anti-inflammatory drugs. But usually the pets are at least going to get some form of post-operative analgesia at home. And then the antibiotics are at your vet's discretion. We're very aware these days of microbial resistance and how it's occurring at a large scale, limiting our ability to use antibiotics that actually work. And so antibiotic stewardship, I think they're calling it, is of importance. Not every incision requires antibiotics. Yeah, and so I think that's a pretty good rundown of how to take care of your pet's incision. Some doctors will advocate putting an ointment on there, whether it be something like Vaseline, which is waterproof, to make sure that if any moisture does fall in the incision, that it can hopefully not stick to the incision. So, for example, I'll do this if I have like a perineal incision, so an incision by the bum area, where it's going to be inherently contaminated and dirty, and they're gonna pee and poop, and so you're potentially contaminating your incision. So maybe it helps in that region. Otherwise, some veterinarians will advocate placing a triple antibiotic ointment on the incision, which again, pros and cons of that, because although it is antimicrobial, which is great, it also does add moisture to the incision. So and it will entice them to lick as well. So those things are optional. I will, of course, plug vettriage.com if you have any questions regarding your pet's incision or any animal questions. But telehealth is a perfect way to get advice for your pet's incision. Instead of rushing over to the emergency hospital for a non-emergency, especially when your vet would probably want to see you back for the incision they created and not have you see another doctor for it. So it's preferred that you get advice from Vet Triage to decide should you be concerned with the incision, should you not be, what can you do to help it from healing, what are you doing that's hindering it from healing, and yeah, feel free. So that's it for this one, guys. We're still working towards having somebody in the audience, hopefully over time, and I hope everybody enjoyed it. Email, or rather message me if you have any topics you want me to talk about, and feel free to donate to the channel as well. Subscribe, hit like, all those things, and we'll see you in the next one, probably tomorrow. Take care.